Hello, I'm Dr. Jon Perlin, Chief Medical Officer, HCA Healthcare. I'm back today with Dr. Karla Miller, our Vice President for Clinical Pharmacy and Therapeutics, and we're following up on our discussion about pharmacotherapy of very ill patients. Some questions came in, had more to do about what about the patients that we see but then send home? What is the appropriate therapy for those individuals that are not ill enough to be in hospital?
It's a great question. For those patients that you do treat in the emergency department, you send home, you're really just using supportive care. So this may be acetaminophen for fever. This might be cough medication for a dry cough over the counter.
Dr. Miller, there's been a lot of question, or in fact concern, about the use of NSAIDs and acetaminophen instead. What is the literature actually showing in terms of the preference for acetaminophen over nonsteroidals like ibuprofen?
Well, it's really interesting. There was a lot of media attention on this earlier, and what has been found is there's really no evidence to say that you should avoid NSAIDs, specifically ibuprofen, in COVID-19 positive patients. So while there was a lot of media attention on it, the World Health Organization even came back and made a statement saying that there is no reason to not use NSAIDs like over-the-counter ibuprofen to treat patients with COVID-19, to treat the fever, to treat aches and pains.
So beyond the supportive therapy, the fever relief, fluids, cough suppression, some of our patients may have other medications at baseline. There's obviously been a lot of concern about ACE inhibitors. There was a nice review article in JAMA Online just in the past couple of days. What should you tell patients who happen to incidentally be on an ACE inhibitor?
Currently, we're telling patients to continue on your ACE inhibitor and ARB. That is information that we are following very closely, but at this time, the evidence has shown it's more dangerous to stop those medications than to continue them.
And on that vein, are there other medications that have come up for speculation as to whether they exacerbate or improve that I want to offer recommendations on?
There's been some discussion about zinc. There's also been a conversation about vitamin C. What I would say as it relates to the medications that you hear to help the immune system, they're probably not harmful, but you need to make sure that you're not taking any medications that these would interact with. Anytime I think about over-the-counter medications, I worry that people feel like these medications are safe. They do indeed have interactions, so it's really important to understand the full medication regimen that a patient is on before telling them that they should take an over-the-counter medication.
And I would imagine that zinc could be a little bit confusing because in high dose it can lead to disruptions of the sense of smell, the sense of taste, and indeed these tend to be features that are now thought to be associated uniquely with COVID-19.
I would absolutely agree. I think when you're thinking about these medications, the more medications you add, the more complicated you can make the situation.
A question that came in specifically about the use of home nebulizers and metered dose inhalers. Obviously, there are patients who, by virtue of their underlying condition, need those. On the other hand, it can potentially present some risks to family members who may not be COVID positive.
For patients with comorbid disorders such as asthma, COPD, et cetera, that are routinely using nebulizers or metered dose inhalers, they absolutely need to continue their medications. Now, there is a risk with nebulizers of spreading it to family members. So one of the safeguards would be to ensure that they're in a space by themselves, closed in, where they can do the nebulizer treatment away from the rest of the family members. But it really is important that these patients remain on their medication regimens to treat that underlying disorder.
Okay, well, there you have it. I want to thank Dr. Karla Miller for these additional insights, and most of all, I want to thank each and every one of you for everything that you do at the front lines of care, seeing patients, taking care of our community, and we know that you're working hard. These are unusual times, and we are extremely grateful.